Antibiotics are widely used for the treatment of infections in humans and animals. However, misuse leads to antimicrobial resistance, whereby the drugs become ineffective against disease pathogens. Antimicrobial resistance is a great threat to quality healthcare services in Nigeria, making it a top national priority for the country. Concerns over the increased spread of antimicrobial resistance have led to a call for action to reduce the misuse and overuse of antibiotics in humans and animals. That's the focus of this week's episode of Health Options. Many thanks for joining us on the program. I am Rabi Abdullah. Welcome back. If you're just joining us, this is Health Options, the program that not only tracks government policies on health, but helps you with the information you need to make informed choices about your health. As we beam our searchlight on antimicrobial resistance, joining me now in the studio for the Nigerian perspective and efforts at reducing the misuse and overuse of antibiotics in humans and animals is Dr. Tochi Okwo, Infection Prevention and Control Program Coordinator and Chair, Nigerian Antimicrobial Resistance Coordination Committee, Nigeria Center for Disease Control, NCDC. You're welcome, Dr. Okwo.
Thank you for having me.
Okay. A lot of us are conversant with antibiotics. Many people just go popping it, not even knowing when to use it, because some don't even go to the doctor to get prescription. Some things just come up with the system, and I don't know, some people wouldn't even know how they come or get to buy antibiotics for whatever ailment comes up. It's on that basis I want you to start by telling us what antibiotics are. You're just going to shed more light and their place in disease treatment or management.
That's a very good question, and indeed a very good place to start the discussion. Antibiotics are medicines that their main job is to take care of infections that are caused by what we call bacteria. To the ordinary man on the street, these are germs, and these germs can be bacteria, they can be viruses, and they can be protozoa and other things. But specifically for antibiotics, we are talking about those medicines that take care of infections that are caused by what we call bacteria. And why are we interested now in antimicrobial resistance as we discuss antibiotics? It is that these antibiotics, which we usually will be prescribed by a doctor when you're ill with an infection that's caused by a bacteria, and they will take care of that infection and get you to feel better. We are losing the ability of those antibiotics to do that work that they do so well. And added on to that capacity that they are losing to take care of those infections is that even the pipeline for the research and development that leads to the bringing in of new antibiotics into the market, it is drying up. And therefore, we must do everything possible to conserve the efficacy of the antibiotics that we have at hand, while we also push for the development of new categories and new classes of antibiotics.
I know that, for instance, if one has a cold, there are some antibiotics that could be used in the treatment of cold. What frequency or at what rate does someone go popping these antibiotics that after a while it ceases to become efficacious or take care of what it should take care of in the system?
It's interesting that you use the word common cold, because the common cold is one of those conditions that antibiotics are commonly abused. First of all, the common cold often is not caused by a bacteria. And remember, we started our discussion by saying that antibiotics take care of bacteria. Some of the common cold, indeed, most of the common cold we have, are caused by things that are not bacteria, they're caused by viruses. And so many of them can be taken care of, just they run their course without any medication.
Because of the high out-of-pocket spending in this part of the world, it's very common to see people just dashing down to the nearest pharmacy or patent medicine store nearby to pick some of those things. I just want to get it clear. If someone has, for instance, because I'm still talking about the common cold, I know, and the person gets to such a facility and the pharmacy or whoever the attendant is just prescribing antibiotics to the user or the would-be user, should we be asking questions? For instance, if I decide to put myself in the shoes of the user now.
What you have described is one of the typical things that drive antimicrobial resistance, being the use of antibiotics for conditions that are, first of all, not caused by bacteria, and also using them without proper prescription, and also not even guided in dosage and duration. And what now needs to be done is that we all must be aware as citizens, as people who utilize health services, that just getting into a pharmacy, getting into a chemist and just requesting that an antibiotic be prescribed because we have a common cold is truly not to our best interest. Why is it not to our best interest? These things drive antimicrobial resistance, meaning that they continue to push these organisms to develop resistance to antibiotics that they normally will be susceptible to. And when patients who truly now need antibiotics, and what sort of patients are we talking about? We are talking about young children in neonatal ICUs, people in intensive care units who have bloodstream infections and now require antibiotics to be prescribed for them. And at that point, no antibiotics then works. That is exactly why we are pushing for this. Healthcare depends on us retaining the efficacy of these antibiotics. And that is exactly why the 18th to the 24th of November every year is set aside as World Antimicrobial Awareness Week, so that we can engage the way we're engaging now. We can have that conversation where we can say you don't just need to step up into every pharmacy shop anytime you don't feel so well and ask that you be given antibiotics. And to the point of out-of-pocket spending, imagine what a waste of money it is that you are actually requesting for an antibiotics for something you don't need an antibiotics for, only for that thing to down the line worsen healthcare generally in the country.
Okay, for a user now, when should an individual now know that his action or inaction is what is responsible for certain things not getting the right outcome or the expectant outcome?
I'm sure every day now, we know stories of people who died from some infection. Sometimes you hear stories where they tell you that every medicine that was prescribed didn't work. We are getting to that point where we are beginning to see those things is becoming quite obvious. And it is also this not being very apparent that what is going on is as a result of antimicrobial resistance. That's why it's difficult often for people to connect their actions such as inappropriate use of antibiotics, irrational use of antibiotics. That's why often people are not able to connect their actions, their abuse of these antibiotics, to something that has happened down the line. Difficult to connect those practices to that patient in the hospital who no antibiotics that's prescribed then works for the patient. And that brings us back to the level of awareness. We all must come together as one health family, what we call one health, meaning human, animal, and environment, and multidisciplinary teams. We must come together to appreciate this problem of antimicrobial resistance.
Talking about misuse now, we human beings are the architect, of our problems sometimes. But for animals, for instance, those who rear poultry and other ones, You see them administering antibiotics from time to time. These animals don't have a voice. How does this constitute abuse? At what point do human beings, perpetuate this? Maybe you should speak to it to enlighten poultry farmers and others who rear animals for business or even for consumption.
That's really a very important question you have asked. The reason is that the drivers of antimicrobial resistance are the things we do as human beings in healthcare. They include also the things that are done in agriculture, and there are also drivers that arise as a result of what we do that damage the environment. Coming to the agricultural side, which is where the rearing of animals, where we have the rearing of animals, there's a lot of use of antibiotics in the animal health sector. And what that does is that because it's basically the same molecules, the same things in the antibiotics we take as human beings that are also largely in the ones that are used in animals, that huge use in the animal health sector eventually finds its way either through our food systems or through the environment, from the waste that comes from rearing the animals into the environment, back into the human beings. So there's this cycle and there's this relationship between human, animal, and environment. So the animal health sector, yes, there's a place for the use of antibiotics, but this needs to be properly regulated. As you have said, the players in that sector need massive awareness. They need to understand where is the place of antibiotics in the rearing of animals. That is why in our national antimicrobial resistance response, it is a One Health one. What do we mean by One Health? We bring together the relevant stakeholders in the area of human health, in the area of animal health and the food systems, and also in the environment, where we come together, strategize, and begin to think about the policies, the regulatory environment where people in this sector must operate in to combat antimicrobial resistance.
Taste. In a world hungry for goodness, with a splash of golden Terra oil, a mom can transform a frown into a smile, make a lunch hour a happy hour. Change no thanks into yes please. Provide care when her nearest and dearest needs it most, and resolve family feuds without blowing a whistle. Providing tasty, nourishing family meals is all that matters. The world needs moms, because where there are moms, there is hope, happiness, and love. Golden Terra Oil, or pure love.
I'm looking at drug development now, because when you look at the time it takes, very long time it takes to even discover and develop new drugs. You won't be, I know it, I know that it takes a very long time. And talking about resistance, antimicrobial resistance, it's something that I've been on, because I remember my attendance of one of the World Health General Assemblies in Geneva. The DG WHO then had really, harped on it, and why, countries should go into research, that would lead to the development of new antibiotics. In that regard, what is being done, in terms of research and development now? Awareness is critical, but even research, because I'm very sure that there must have been maybe findings or survey that must have revealed some of these drugs that are not really or no longer efficacious, in treatment, and why some new ones need to come on board. Where are we in this part of the world?
In the area of new antibiotics, it's a complex situation. There are a lot of discussions going on globally in this area. Everybody has now acknowledged that the pipeline leading up to new antibiotics coming into the market is drying up. And the time it takes from when a new molecule is discovered to when it will really, really be available for us to use, it takes a lot of effort, it costs a lot of money. So there's something we call the tripod of innovation, stewardship, and access. Attention is now being paid to the fact that, yes, there's a huge need for innovation to bring new antibiotics to the market. But importantly is also there has to be this collective push to be good stewards of both the ones we have now that are working, because we talk about antimicrobial resistance, but indeed there are antibiotics that are working, and we must put everything in place to preserve the efficacy of those ones that are working, and then access, universal health coverage. People, when they go to hospital, must have access to diagnostics that allows them to take a sample to the lab, have good quality labs that are able to test those samples, and then provide good quality lab results that also tells the physician, this is the organism causing this infection. These are the antibiotics that this organism is susceptible to, and therefore these are your options for prescribing antibiotics to this patient. So all these things come together. The world now is looking at options for innovation. There are also options to overcome some of the hurdles to bringing new antibiotics into the market. Regulatory framework, the regulatory environment that allows for clinical trials, because it is also clinical trials that lead to the development of new antimicrobials. Okay. WHO has also identified what they call priority pathogens that every effort should be made towards coming up with antibiotics for these pathogens, because they are the ones that will cause the most problem if efforts are not made to conserve the antibiotics that are susceptible to, and also to bring out new antibiotics that will tackle them.
Okay. Since a lot of emphasis is on the human beings as users now and administrators, what would you be saying when you consider, like I said earlier on, the health-seeking behavior of people, which entails someone just stopping by at a pharmacy or a patent medicine shop to pick antibiotics for one ailment or the other? What will you be saying to users, the pharmacists themselves who prescribe or administers, the patent medicine vendors? What would you be saying to them? Because that synergy should be such that there's the information, and that the information trickles down to those who should know about.
I will say to all of us, we must all act together. It is indeed in our very best interest that we conserve the antibiotics that we have, that we do not destroy years of effort that has resulted in giving us this precious gift of antibiotics that has basically prolonged our lives, that gives us an option when a premature baby is born and gets an infection and can offer that child, that baby, an opportunity at life. That we do not unravel all these things because of the things we do. Every infection, every cold that you have is not necessarily caused by an antibiotic. And therefore, we must follow the guidance of our healthcare workers. As much as is practicable, we must go to the hospital when we have certain infections so that our doctors, our clinicians will test it in proper quality assured labs and prescribe the right antibiotics in the right dose, and also tell us the duration to take it if indeed what ails us requires an antibiotics. It is no longer the time where antibiotics can just be used simply because people are seeking to make a profit. It will really not be in our best interest if we continue that way. But I do believe that, as I've said earlier, a lot of this is as a result of not being aware of the damage. So if we all join hands in this race against time, because it's truly race against time, if we do not do something, we might be heading to a post-antibiotic era, and we know what that means for all of us.
What could be the worst scenario now? Can you paint it?
There could be many worse scenarios, but it could be that you have an infection, a wound infection, a cut that gets infected, that an antibiotic would normally have taken care of it. And you go through 3, 4, 5 courses of antibiotics and none works. It could be that with all the advances we have made in medicine, somebody goes and is able to do transplant surgery, for instance. But because of the vulnerable state of transplant patient, they require antibiotics sometimes because of infection, and it will be that infection they have is an infection that is caused by a multi-drug resistant infection. It will be such a pity that we have made such advances in healthcare and then lose antibiotics that help us to offer more complex healthcare.
I want to know, can antibiotics be used to treat viral infection? Because initially, I was already getting this, I don't know whether to call it erroneous impression that you do not use antibiotics to treat viral infection, but bacterial infection. Because right now, I'm even in a cold, and I will tell you that part of the medication given to me is antibiotics. And I know that even during COVID, there was a lot of mention on the treatment regimens that has to do with antibiotics. Can you just clarify this?
In the name, you have mentioned antiviral, you have mentioned viral,
Yeah.
and then antibiotics. As I've said, antibiotics are those ones that target bacteria, meaning that the infection that you would prescribe an antibiotic for after a proper lab test has been done and what we call antibiotic susceptibility testing has been done will be those ones that are caused by bacteria. So taking antibiotics for a viral infection, it's not right. But often you find that that is the situation where even for viral diarrheas, children with diarrheas that are caused by viruses, parents sometimes just keep giving antibiotics. Those are the things that drive antimicrobial resistance.
Wow, so much to learn. Thank you so much, Doctor. I think you just say your final words to Nigerians, because this is a very, very, topical issue that I think everybody should, get to know more about for safety purposes. Just give us your last shot.
Antimicrobial resistance is truly a problem. It is with us. But the beauty of us as human beings is that we possess what it takes to understand the problem. We have what it takes to take decisions to reverse whatever is a challenge. For us in Nigeria, the approach we are taking is a One Health one. One Health whole of society, as we all engage in this World Antimicrobial Awareness Week, what I ask every Nigerian to do is to seek information. Let us all find ways to inform ourselves about this problem of antimicrobial resistance. There is something we can do, even if it's through improved hygiene, washing our hands, as we have discussed here today, making sure that we just do not take antibiotics just the way we like. Talk to your friends, talk to your family. If you're a healthcare worker, think about how your actions are driving antimicrobial resistance. If you play in the agricultural and food systems, think about ways you can contribute to addressing this challenge. In the environment as well, let us all come together and combat this menace of antimicrobial resistance.
Okay, thank you so much, Dr. Oko, for spending time with us to discuss this very important topic. We hope you can come again when we call on you.
Thank you.
So, don't misuse or overuse antibiotics, but keep to your doctor's prescription and adhere to dosage. Not doing that could cause a lot of damage, so beware. That does it on Health Options for this week. Go to our YouTube channel to watch the upload of these and other episodes of the program. My name is Rabi Abdullah. Many thanks for watching. Hope to see you again. Until then, do stay safe.